Well, there are some diseases and infections that were almost wiped out 2 decades ago, but a new study shows these same STDs are making a comeback in this country and in the Silver State. Thanks for joining us here at 6. I'm Denise Valdez.
And I'm Brian Loftus. The data is really staggering. Nevada seeing one of the highest spikes in the nation. Victoria Saha looked into the numbers and what they mean to our city. Here she is. Victoria?
New studies show us that there have been a 500% increase in STDs over the last 20 years in the country. Nevada has seen the 4th highest increase in the nation, but it's not impossible to combat the issue. There are dozens of different sexually transmitted diseases and infections out there. But a study by Interbody gives us a breakdown of how many reported cases of HIV, gonorrhea, syphilis, and chlamydia there are in Nevada. While chlamydia is the highest, there is concern about syphilis, according to family practitioner Dr. Elena Garcia. It's one of the diseases that could be misdiagnosed.
So it can be very, very tricky.
In another study by Value Penguin, led by health insurance expert Nick Van Sant, he says nearly 20 years ago, syphilis was close to being eliminated and chlamydia was easier to detect.
The numbers are absolutely a cause for concern.
So what happened?
We're seeing a decline in sexual education. We're seeing a decline in preventive measures, and all of that has equaled to an increase in STDs.
This study by Value Penguin showed the STD rates per 100,000 residents in Nevada for the year 2000 jumped from 276 to 857 in 2020. Dr. Garcia says there are new drugs out there to help prevent certain STDs, but they don't work for all of them.
It really does come down to nothing works for everything, so that's why condoms still remain important.
She also says since STDs are hard to detect right away, she recommends getting a blood test every time you get a new partner. Dr. Garcia also recommends getting tested every year as a precaution. And from the studies I looked at, I learned most health insurance will cover the cost of STD testing and treatment like any other health condition, though there may be a copay. Denise?